Mayor de Blasio is advising everyone in New York City now to cover their mouth and nose with a mask, a scarf, or bandana when leaving home. The mayor is asking residents to leave surgical masks, though, and those N95 masks for healthcare workers and first responders. The White House is considering the same recommendation for hotspots across the country. President Trump also today announced the $349 billion relief program to help small businesses will be up and running tomorrow. And the Treasury Secretary says those federal stimulus checks of up to $1,200 could show up in bank accounts in as early as 2 weeks. Now, all of this as the urgent need for hospital beds to treat COVID-19 patients intensifies. Today, the president pushed forward a plan to open up more beds in the city. But as CBS 2's Ali Bauman reports, in addition to those beds, there's also an urgent need for more doctors and nurses.
The things that I see in the ER are scary. I'm a little scared myself.
Dr. Matthew Bay gives us a glimpse of his new reality at Mount Sinai, Queens.
You can see all the rooms are filled. Usually these halls are very neat and empty.
It's challenging, it's draining. We see nurses crying a lot.
Hiram Torres is vice president of operations at Bronx Care Health System.
We're using all available space in the hospital.
But to cover all that space, he says the Bronx Hospital desperately needs more doctors and nurses. They've already moved more than 100 administrative employees to do jobs like deliver meals to patients.
Our own staff are getting sick. We're having to use contract labor to come in and help where they can. And even that contract labor gets sick.
Mount Sinai has started sending patients to Central Park medical tents. These pictures show the first being treated inside. The USNS Comfort is treating non-COVID patients. Initially, the federal government said the 2,500-bed facility at the Javits Center would do the same. But tonight, the White House reversed course.
We're going to be converting that to a COVID-19 hospital.
Mayor de Blasio says more than 2,000 beds and 700 ICU beds will be added to the city's public hospitals by next month.
We need protective equipment, and we need it now.
Thursday, Montefiore Hospital nurses protested for more gear like masks and gowns. Governor Cuomo says the state will now review each hospital's inventory and disperse supplies accordingly.
Every day when I go to work, I feel like a sheep going to slaughter.
And with so many 911 calls, city ambulance crews are changing how they treat cardiac arrest patients. If first responders are not able to revive a patient on scene, they're now directed to pronounce the person dead instead of taking them to the hospital.
This is a wartime mentality.
And on the front lines, doctors and nurses know the worst is still to come. Ali Bauman, CBS 2 News.